Unique opportunity to catch up with someone who knows all about family violence. She's a survivor, two-time survivor, and she's become a family violence advocate these days. Her name is Cathy Oddie. Cathy, welcome to The Informer. Good to get you back into the studio. Tell me about your journey. Since the last time we spoke, you've become more of a consultant, haven't you?
That's correct. So since we last spoke last year, I was actually working at Monash Health with their mental health family violence project team. So that meant I had the opportunity to be part of reviewing their policies and guidelines. I was part of facilitating training to their drug and alcohol and mental health clinical staff, as well as sitting on a variety of committees and so forth. And so that gave me a really great opportunity to be part of the Strengthening Hospitals Response to Family Violence initiative.
Did you ever consider that a year on, or a little more than a year, we would be talking about family violence again, but in a very different way, impacted by a thing called COVID-19, the pandemic that's swept the globe? What do you think it's done to this epidemic that I thought we had of domestic violence? Do you think the levels have gone even higher? Do we understand whether the reporting at the moment is accurate?
What we do know is that in times of disaster and crisis, such as what we've seen previously, for example, in bushfires or the New Zealand earthquake, is that the factors and the environment that creates, that actually increases rates of family violence. So what has happened in the course of the pandemic, because it's not like a one-off event as such, it's been an ongoing event that we're still experiencing and responding to, that in the beginning, I guess there was an expectation around family violence and mental health issues that we're going to see an increase in the rates of people in crisis. Initially, there wasn't the contacts with services that were anticipated.
Correct.
However, there's very good reason behind why that's the case. But before I go into what that reason is, I would like to say that yes, there has definitely been increase now that restrictions are starting to lift. And also in regards to those who already had underlying mental health conditions, the rates of people needing to access mental health services has absolutely exploded. I know from a personal family member that recently it took them, for me, to get them 2.5 weeks to actually get a hospital bed in the adult acute unit. So you have to look, for example, when this applies in a family violence situation, and for example, like at Monash Health, just along supporting victim survivors, we're also supporting perpetrators. So if a perpetrator is not getting the medical help they need to address their health conditions, they could stay not only in this pressure cooker environment of already perpetrating behaviours that had been happening prior, but having their mental health condition triggered, so it elevates things to a whole other level.
How do we help one another, even through these enormous times of restriction? You've said before, where we've talked, it's really important that we don't have enablers. It's very important that if people see something, they step in. Well, when you're hidden away, or when you're you're told to stay at home, and that's your only place of refuge, who can come to your rescue?
It's really reduced the touch points that people can have to actually engage, do that help-seeking behaviour. And things even just as simple as doing like a web chat with a service provider or making a phone call to a helpline has been something that's been, for what the reports that have been received, has been restricted as well. Because if you're trapped at home in an environment with your abuser and they're monitoring everything that you're doing, you can't make that phone call.
You can't do anything.
Yeah, so that's what makes people who have the opportunity to play an active bystander role so vitally important at times like this. So this is where, for example, neighbours are going to need to play a greater role. If they're overhearing things like really...
So reporting is even more important than it's ever been?
Absolutely. It's those sort of touch points which are so important, that if people are noticing someone in distress, that they actually show that human care and compassion, because doing something is better than nothing. And I know there's a lot of, I guess, for many people who don't work in the family violence sector, that sense of, oh, I don't want to get involved, this is a private matter,
Correct. Yep.
or I'm going to say the wrong thing. However, it's as simple as just asking, are you okay? You're looking a bit upset. Someone will talk to you about things if they want to, but the fact that you've noticed them and seen that they're going through something will help them not feel so invisible. Because I know that for me, in my experience of the 2 relationships which I survived, there were so many times where even when I was quite visibly showing injuries and quite obviously distressed, in need, people would just walk on by or would not address it. Like I'd be turning up to work and having bruises all over me on a regular basis, and no one ever asked that simple question of, are you okay?
There's been a state-based campaign on domestic violence. We've seen a national campaign, and we've seen so many other services. The Are You OK has also been a campaign that's run pretty successfully right across the country. And I've seen it in social media, I've seen it in so many other spheres. Are you pleased to see it? And is it actually cutting through?
I think all these awareness raising campaigns are important, but it needs to be backed up with funding to services and really strong policy. Because otherwise those campaigns are just toothless tigers if you're not actually helping to change the underlying community attitudes, and also not creating an environment where people can feel safe and supported to come forward, whether they're the victim survivor or the perpetrator, because it's really important that perpetrators are addressing their problematic behaviours. And that's sort of one of the issues too that's come out during this coronavirus pandemic, is actually around men's behavioural change programs, and the challenge around, particularly for those perpetrators who've been court mandated to attend programs, and how do you facilitate that at a time like this?
Also the other question, culturally, are we seeing different cultures within our community suffer more or less?
Well, so in regards to, I would say, the people who are at particular risk are people living with disabilities, Indigenous women and children, people whose English is not their first language, and also may have cognitive impairment and so forth.
Yep.
So if I was to focus at the moment in regards to people who are on temporary visas, they are probably the most vulnerable part of the community, aside from those living with a disability. For those on temporary visas, they haven't been enabled to receive any financial support such as the job seeker or job keeper. So
it's left for the Salvos and other agencies, the Red Cross and so on, to come to their assistance. If you see a problem, what's the number again to call? 1-800-RESPECT,
or if it's an immediate crisis situation where someone's at immediate risk, is 000.
Cathy Oddie, as always, it's been a delight and a pleasure. And again, I hope the interview gives us an opportunity to help people who are struggling at the moment, especially during the COVID pandemic.
Well, UN Women has referred to this as the shadow pandemic, and that is why it's so critical that the government's response on both the state and federal level responds appropriately. Our Minister for Family Violence and Women, Gabrielle Williams, here in Victoria, has started a campaign to recruit more people towards the family violence workforce and put a real focus on that. So that's definitely what's needed, and to have that backed so that we can be providing a response to the community members who are affected.
Thank you, Cathy. Well done.
Thank you.